Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. So in the last video, I was talking about, and I talked to you about the idea of getting restarted, getting rid of all your kind of self-condemnation and negative thinking, or what we call stinking thinking about the position you're in, and just kind of looking forward and being positive and getting restarted, and come in, let the staff build you up. We're not going to beat you down, and we know that it's human to be in this position, and if it was easy to be thin, we'd all be thin. It's not so easy to be thin. So I've talked in the past about obesity being a chronic, lifelong disease which you have to manage. And so I want you to imagine we were talking about blood pressure. And if you had high blood pressure and then you went to the your primary care doctor, and they diagnosed you with this, and they put you on a blood pressure pill and suggested some lifestyle changes, and you did those things, you got your blood pressure under control, and then for some reason you then got off track, stopped taking your blood pressure pill, stopped going to see the primary care doctor, and your blood pressure went back up, you know that the answer is to get restarted again, to go back to see your doctor, get the prescription for the blood pressure pills, get back on those, start implementing those lifestyle changes that your doctor would recommend. And that's just kind of a different way to look at obesity. When we're talking about other disease processes, you're used to thinking that way. So if you're off track and you're not taking any medicine, you're not coming to the office, your weight's going up, you can't get it under control, you're dealing, I pointed this out a lot of times, you're dealing with a chemistry here, and you're dealing with a disease process. And the best step you can make is to say, okay, look, from a behavioral standpoint, I want to get restarted, get my stuff in order, and I need medicine to help me do that and to help get this chemistry right. So I'm going to call and make an appointment to see Dr. Simons and his staff. We're going to help you with that. We're not going to judge you or anything like that, and we're glad to see you and to help you get restarted and to encourage you. So again, if you're in this position, remember, obesity is a chronic, lifelong disease, and it has to be managed. And if you're off track and you need help, please ask us for help. So until we talk the next time, I'll give you the tools, you give me the effort, and together we overcome obesity.